So the $1,000,000 question, what is lupus? Let me tell you. If you click on this video, that means you're probably someone who has lupus or someone who thinks they have lupus, and you're trying to figure out whether or not these symptoms that you're experiencing are all in your head or if they're real. And I guarantee you they are real. If you're a loved one of someone with lupus, this is going to be a great video for you too. You are awesome for clicking on this, and you are amazing for even trying to support your loved one. This video is going to go into detail, and I'm going to describe exactly what my symptoms are and how they can relate to someone who is healthy, so that you can better understand that we're not being melodramatic and we are really experiencing severe symptoms, even though we look fine on the outside. So the definition of lupus is it's an autoimmune disease that it can affect any organ in the body, and it primarily affects women, although it can happen to anyone of any ethnicity. This is a systemic autoimmune disease, and that means when your immune system attacks itself and it attacks any organ in the body, and that's because it mistakes those tissues as foreign invaders. There are variations of lupus. You can have mild, medium, or severe. It's more common in African Americans, Hispanics, and Asians, as well as Middle Eastern. 9 out of 10 of those with lupus are female. There are different types of lupus. There are 4 different types. You can have systemic lupus, which is the most common. You can have discoid lupus, which primarily attacks the skin. That's where you get scaly rashes, or you could have hair loss. It could happen anywhere. It's really painful, it's itchy. It's very uncomfortable either way. The third one is drug-induced lupus. This happens more often with men, but it can happen with women too, who are on specific medications. That usually goes away as long as you stop the medication, and I think about 6 months. The last one is neonatal lupus, and neonatal lupus isn't exactly a typical lupus case, but this is when a mother who has lupus passes on those antibodies to a baby, and it can be pretty severe. If you want to stay in the now and hacking your way through lupus symptoms, you definitely don't want to miss my videos. So make sure you subscribe and hit the bell, most importantly. That way you'll get a notification of my weekly release on Thursdays. Quick fact on lupus. Did you know that it takes an average of 6 years for a diagnosis? That means in those 6 years, someone who is not receiving treatment is more likely to have organ involvement, have premature death, and even lose their job, their home, relationships, and that's all because they're experiencing these crazy symptoms that they just can't pinpoint, and they have no medical backing. So that means they're losing everything with no support. So it's really important to write down everything that you experience, when you experience it, how you're feeling, what you're eating. It's really important to track everything, and that way you can help your doctors figure out exactly what's going on with you. Because even if they rule out lupus, something else is going on, and it's important to figure that out. Anyways, let's get back to our what is lupus, and how am I going to describe all these symptoms. I'm going to tell you exactly what lupus is and how it feels, so that way you can better understand how it's affecting you and if that symptom is normal or not. And if you're someone who doesn't have lupus but you're trying to understand, I'm going to give you examples as well. So first, lupus is a very debilitating autoimmune disease, and one of the hardest parts about it, I think, is the fact that we look healthy, but quite literally feel like we're dying inside. And that is so stressful on our body, and stress is a trigger of a lupus flare-up. So you can see how the vicious cycle keeps going and going. So it's really important to be confident and believe in yourself when you're feeling something, whether someone says you're not. Really important to manage your stress too. I mean, it's so difficult. I mean, I can't tell you how many times people's mouths have dropped to the floor when I've told them that I have lupus, or that I've been very, very sick and in the hospital, and just a week before I was completely fine. So I understand how frustrating it can get, and I totally get it. So it's just something that we have to learn how to communicate so that it doesn't happen to us as often. All right, Lupus warriors and Lupus family and friends, question. Have you ever seen someone have a peanut allergy, shellfish allergy, or maybe an allergic reaction to like a bee sting? So on the outside, you can see their skin reacting. They're swollen, they're very hot to touch. Sometimes they're, it could be an anaphylactic shock where they're not breathing. That's very intense. That's a severe version. But the other symptoms that you see physically is exactly what's going on in the inside of our body. And again, that's because our immune system thinks that there's these like foreign invaders, but it's really our organs. So it's going in there and it's like, I'll save you, I'm gonna protect you, and it just starts attacking and killing all those cells. Literally, these cells are engulfing all of the healthy cells that are keeping us alive. So you can see how painful that is. The problem is, like I said, is that you can't see it physically, but we are definitely experiencing it, and it is 100% painful and debilitating. So while I look completely healthy on the outside, my body's like, oh my God, that's a kneecap, I have to kill it. And it's going in and it's engulfing all of those cells. And I'm like, no, please don't. I need my knee. I need to walk. I need to like clean the house. I need to do things. So please stop doing that. And my body's like, no, it's okay. I got you. I'm gonna protect you today. But in reality, I can't do anything. Maybe it's a day where I can't even go outside or I can't walk down the stairs. That's the reality of it. It is so debilitating. Sometimes all you'll see is like swollen joints. It could be your hips, it could be your fingers, your knuckles of your fingers can be swollen, it can be your wrist, it can be any joint. And because of that, sometimes you'll see the actual swelling or you can feel it. Your bones will have, actually sometimes they'll calcify, and you can have growth around the joints, and that usually does happen to a lot of us. Other times it's not permanent damage, and that is usually the case with lupus unless you have other underlying issues. So your joints could be red, they could feel really hot and tender to the touch, and they can be swollen or like squishy if you push on it. It's because all the fluid is collecting there, and it's creating an inflammatory response, which is a good thing in short term though. But because lupus is a chronic inflammatory disease, that means our body is reacting too much too often, and that's very stressful. Another common symptom is bone pain. So this type of bone pain, imagine someone taking a hammer and slamming your bones and breaking them. That's exactly what it feels like. It doesn't feel like growing pains. It literally feels like your bones are breaking. The good news is that it's not permanent damage and that's not really happening. And the other good news is that there are solutions, which I will definitely get into. Sometimes lupus can attack your tendons or get bursitis. That's when your tendons are inflamed and very tight, which reduces the mobility and flexibility of your joints. It causes a lot of pain, so like you can't sit long, you can't stand long. You're basically a 20-year-old in a 70-year-old body. When you're going through chronic pain like this, it's very debilitating and it's exhausting. So even though we're not really doing much, let's say we're sitting on the couch watching TV or we're watching something, streaming any videos on our computer, it's exhausting to fight yourself all day. I mean, just think about it for a second. If you ever get exhausted from arguing with someone, imagine your body arguing with itself 24 hours straight, 7 days a week. That is exhausting mentally and physically. So next time someone's complaining about joint pain or bone pain, just give them a break, let them have their pain day, and just be there for them. Have you ever been around puppies or babies or even toddlers? You ever see those videos online where like toddlers are mid-food bite and they're just pass out? That's lupus too. Our body's so sick of fighting that it's exhausted. So a lot of us us are really tired and get very tired fast. And then the other side of that is even though we're exhausted, sometimes we suffer from insomnia. Our internal clock gets all mixed up because it doesn't know what's going on or what to do. So a lot of us can be up really late even though we're so exhausted and want to sleep. Stomach pain. We've all had it, we've all gone through it. So I know you definitely understand what stomach pain is, right? But with lupus, it can be different sometimes. And with this stomach pain, it feels like the insides are burning. It feels like someone's taking a torch to your colon and just burning it from the inside out. And it's so painful. Other times people can experience, like, just in their stomach, horrible bloating, inflammation. And a lot of times the triggers can be food related and we just don't know. So that's one way to help our body kind of relax and take a step back. Because every little thing does count. We are more sensitive. Oh my gosh, another symptom, nausea. Have you ever been pregnant or have you been around someone who's been pregnant? When they describe the pregnancy nausea that they have through their first trimester, that's pretty relatable. Or maybe someone who's been on chemotherapy medications, as that is a common treatment as well for people with lupus. The nausea is debilitating. It makes you get a migraine with it. Sometimes it's so painful, it makes you just want to like die inside. So nausea is serious and it can get serious and it will definitely keep you laying in bed. And because of that, sometimes when lupus is attacking our stomach or our intestines, we can't eat. And that creates a vicious cycle again of losing nutrients, so our body can't fight it and our body can't sit back and relax. Another common symptom of lupus is brain fog, memory issue, memory loss, and confusion. This is something that affects me really bad sometimes, and it affects a lot of people. And this can be for a number of reasons, and I will be able to provide solutions as well. And it'll be later on in this video. But for now, memory loss could be someone explained something to you and you forgot it short term, or it could be long-term memory loss. It's frustrating. So another issue is confusion. Whether you said something that is easy to understand and comprehend doesn't mean that someone with lupus is going to understand it right away, and they might need a second or two to digest the information. And it's not something that they can control. So this can happen more often when you're having a flare-up. It could be a daily symptom that you're experiencing, and that could be tied to a bunch to different vitamin deficiencies. Other times, a lot of people with lupus will mix up the sentence structure. So sometimes they will say, yesterday I biked the road, instead of yesterday I rode the bike. We don't catch it right away, but sometimes we'll catch it and like, well, that didn't make any sense. So be patient with us. But this is something that's frustrating, especially with something so simple like that, you know? So next time you're talking with someone and they're having a difficult, I call it like a brain fog day, be polite and say, hey, I think you meant this. And that will help them be more conscious about what they're saying so that it can be something that's more controlled. But obviously don't, mock someone or make fun of them, because it's a very sensitive subject for most of us. The lupus warriors, next time you're going through some of these symptoms, just know that you're not alone. We are all here on social media. We're happy to connect. We're all going through it too. And of course, there are solutions to most of these problems. Some uncommon symptoms that do occur is CNS involvement, and that's where seizures occur. People have seizures that can be triggered from migraines. They can be just, random, and it can be very, very serious. Another symptom is blood clots. So a lot of us have APS, or antiphospholipid syndrome. I think about half of the population of lupus will have this. And that basically means that you're more likely to suffer from heart disease and have a blood clot. So it's important for your doctor to run those tests. Sometimes that does get missed, so it's something that you should definitely write down. We have a poll right above, so here's a question for you guys, and I'll give you the answer later on in the video. Question is right above in the poll. Do you think lupus is environmental or is it genetic? So now it's time to get into the solutions of these symptoms that I've described. But first, let me give you the answer to the poll. So the question was, do you think lupus is genetic or environmental? And the answer is, it's both. So lupus is more likely to occur in someone who has a family member with lupus, but that doesn't mean it's 100% of the time. I am actually someone who has lupus, and I have no one in my family with autoimmune disease. Definitely an environmental autoimmune disease, which means that there are solutions to manage your symptoms with no debilitating side effects. It's really important to test for heavy metals. A lot of us have heavy metal toxicity, and a lot of times we're not showing like the telltale symptoms of mercury poisoning because it's not that advanced. It's too much of a toxic buildup in us, and that is one of the triggers. Now there's never just one trigger with autoimmune disease. Usually there's a few things going on. So once you find the tests that you need, you'll be able to have solutions. So if it's heavy metal toxicity, that means you can have follow a protocol that helps pull out all the toxins that are stored in your fat, that are stored in your brain, which contributes to memory loss. It's stored in our liver, kidneys, stored in a lot of places. So once you're able to extract that, you will start to have decrease of symptoms. Another important test is your stool. It's gross, but it's really going to be helpful. A lot of us don't have a healthy diet, and what you may think is healthy is probably not, unless you're eating a plant-based diet with no pesticides, no chemicals, or no preservatives. It's not going to be helpful, and it's actually going to be contributing to all of your symptoms. So we have to clean up that diet. I have a link below on the blog on ways to jumpstart your proactive lifestyle. Did you know that gluten, dairy, and soy are also triggers of symptoms? See, the thing is with gluten is that it's not the same protein that our ancestors had. It's a lab-created protein, and that's why our body is rejecting it, and that's why it's so common in most of us to have a lupus or to have a gluten intolerance. It's actually a medical thing now. It's an ICD code, so it is legitimate, and people who avoid gluten, who avoid dairy, and who avoid soy show an improvement in brain fog, joint pain, stomach issues, and so much more. And lastly, to really get ahead of the game, I do recommend to see a doctor who practices integrative medicine. And that can be all different types of doctors. It could be a rheumatologist, it could be any specialist, it could be a naturopathic doctor, or a MD. Anybody can do it. They would have to go for further schooling once they've had their medical degree. These doctors look for the triggers of disease. They take all the tests that you've had and they add on more tests that I mentioned before, and then they look at optimal ranges. So if you are a low normal or a high normal, that means you're not normal. That means there's something going on, and that supports you feeling like crap, but your blood work looks fine. So, doesn't that sound like a great solution? And it's easily attainable. I have a link below, some recommendations. You can read the blog, so you can watch another video actually, where I interviewed a phenomenal doctor. Check out the video above for a phenomenal doctor who practices integrative medicine. Did you find this video helpful? I hope you did. Make sure you sub if you love it, thumbs if you liked it, and make sure to subscribe so that you never miss out on any lupus life hacks. Thanks again, guys. See you next week.